Good evening, everyone. A warm welcome to this neurotherapy session. This is specially free sessions from our Acharyaji Ramchandran sir for all of you. So I request you all to please make a note, keep your paper, note, everything ready so that whenever whatever information is provided by sir, you could note it down because PDFs, everything would not be provided as this is a free class. So I request every one of you to please make note of everything. And please remember Lajpat Rai Mehra's neurotherapy is very famous because whatever treatments we follow, it follows through root cause. So whatever the root cause might be for you, that will be treated. Finally, your problem will be treated. So whatever we are going through, it might be some silly problem also. So that also might be treated with this particular neurotherapy treatment. So everyone are requested to please concentrate in the session and without much wait, I pass over the mic to Sir. Sir, good evening, sir. Please take over the session. A warm welcome to you from all of us, sir. Thank you from Joshys Kerala Group.
Okay. Good evening to all of you who have started your journey with me. Many of you must be continuing your journey with me. And earlier we met in diabetics challenge classes and diabetics classes here in the group also. And today I have taken another topic which is of general interest to all. And that's a very vexatious topic and very rampant topic. And that is the topic of high blood pressure. Now, since number of people seem to be new, so I am giving you a brief outline as to how neurotherapy we are viewing diseases. As Madam has rightly pointed out, we go to the root cause. So we treat the systems. The symptoms get corrected by themselves. That is the simplest way in which you can understand it. We treat the systems and the symptoms get corrected by themselves. So now, the name neurotherapy is actually a short name for Lajpat Rai Mehra Neurotherapy, LMNT. So LMNT means neurotherapy means Lajpat Rai Mehra Neurotherapy. And from the name itself, you can understand the founder pioneer is the late lamented Lajpat Rai Mehra ji, whom we call as Guruji. Of course, he is got a this thing academically. He is got a doctorate of science from Zoroastrian College, and he has been honored with many other accolades. But basically, he is not a medical doctor. So that is why I did not introduce him as Dr. Lajpat Rai Mehra, because many people may confuse and think that he is a medical doctor. He is not a medical doctor, but he had more knowledge than many medical doctors. Okay, and he used to study a book of medical physiology called Textbook of Medical Physiology by Guyton. That is the standard book on physiology for all medical students. So with this background, the technique focuses on treating ailments by stimulating specific points in the body. That's what we are stimulating. Just 1 minute. Okay. So it is rooted in the belief that the navel is the epicenter of the body. This is another thing which we are concentrating as a rule. The navel is the epicenter. The brain, heart, they have their own functions, but the epicenter of the body, the entire body from the childhood is from the navel. Because the navel is the one which links, the umbilical cord is the one which links the mother to the child, through which the child gets nourishment, everything. And that is the navel. And a small displacement of the navel from its original position, that can cause havoc. That's what we are following, and we are able to get results. So Dr. Mehra developed this innovative approach to help people without relying on medicines, blending the ancient Indian philosophy with modern anatomy and physiology. So the principles of modern physiology and anatomy are used, but they are blended with ancient techniques. The very common technique which many people in North India will know, that is called Nabhi Kisakna, Ladara, etc. There are other names also, Pechoti, Duty, Ladara, etc. That is the very famous technique of setting the navel, which we use fundamentally in various other ways. Okay. So what are these things? It offers treatments for conditions like paralysis, piles, digestive disorders. We will see a bigger list later. These are just to give you some of the small things which we are doing. And what are the techniques which are used? So we use various techniques to stimulate and balance the body system. So that is the thing, balancing the body system. That is the crux. So some of the key methods include, one is called pressure application. I will be showing you some types of pressure application. And in this class, I will be trying to give you certain techniques by which you can help your own body to start the healing process. So applying pressure to specific points in the body, which it stimulates nerves, it improves blood flow, stimulates blood and lymph flow, circulation, etc. Then manipulation of the navel. So adjusting the navel's position to restore balance. I told you the navel, displacement of the navel is the most important thing which we see, and we are able to adjust it by various techniques. Okay. And then, of course, proper alignment and flexibility is also stressed upon to enhance the body's natural healing process. Again, we believe, we know rather. I will not say we believe. The word believe is often used just to say that I do not know whether it works. I am told this happens. No, I know. We know it for a fact that the body has a natural healing process. And that is the process which we are trying to rejuvenate. And of course, certain dietary recommendations will be there. And by all these, what we do, we address the root cause of the ailments without relying on medication. So now, a small explanation of how the pressure application technique is done. So it is a fascinating process, really, because it focuses on stimulating specific points in the body to restore balance and promote healing. So we'll explain how it works. The first thing we do is we identify pain points. Now, by saying pain points, I don't mean the body pain, joint pain, headache, neck ache, shoulder pain, all these things. No, these are not what I mean. Around the navel, Dr. Nehra has identified about 16 points on the front side and about 4 to 8 points on the back side of the navel. And these points, irrespective, I repeat, irrespective of what the disease is called, these points are there, which are more or less common. That means the disease may have 2 or 3 different names, but if the pain is at a particular point, if we give any treatment to remove that pain, which pain we have identified, we means, I don't mean myself, I mean Dr. Mehra and his colleagues. So we are all together. We have identified the moment we give a treatment to remove that pain, whatever other problem, be it headache, be it neck ache, be it shoulder pain, whatever other problem which the body may be facing, that gets corrected. That's the beauty of this technique. And of course, every technique has its plus and minus points. You are as healers, you know so many techniques. I want you to also pay attention to this technique and learn this technique, because this technique is doing wonders. Okay. So then application for pressure, application of pressure. So I told you that we identify the pain points around the navel and other key regions. And by this, we are able to correct the imbalances in the blood or lymph flow. Okay. Then next is pressure is applied to these predetermined points. Dr. Mehra has identified certain places on the thighs, on the hands, on the legs. He has identified certain places and certain sequences and certain method of application of pressure. So all these things will be taught to everybody, who is going to continuously attend my lectures. So by that, what we are doing, it is normally around 6 seconds pressure. And by this 6 seconds pressure, we are redirecting the flow of blood and lymph from areas of excess supply to areas of deficit supply. I repeat, by applying a pressure of 6 seconds at strategic points in strategic sequences already given by Dr. Mehra, what we are doing is we are directing the flow, directing or correcting, let us say, the flow of blood and lymph from areas of excess supply to areas of deficit supply. So simple. So you can understand this. Our body has got a limited amount of blood, 5 liters of blood, say, on an average, and that blood is circulating within the body. And due to our wrong posture, due to our posture like this or like this or like this, all these postures which we often have the habit of following, or we are slouching and sitting, so nice, so comfortable. I don't sit like this, I sit like this. It's so comfortable. But by doing this for 1 day or half day, it does not matter. But when we make a habit of doing this, when we are habitually slouching or sitting in a bad posture, we are forcing our blood to flow more in certain areas and less in certain other areas. And what we are doing in neurotherapy is just to reverse that. We reverse that flow. From areas of excess supply, we say, now you go to this area. And how do you know which area to go? That is where Dr. Mehra's expertise comes. And that is where his experience of more than 75 years. He was 85 when he passed away. And from his 10th year, he has been formulating this therapy. I mean, he calls it, of course, the grace of God. And of course, it is true. Otherwise, you can't expect a child of 10-year-old to be able to heal people, which he had started. At the age of 10 or 11, he had a severe problem in his stomach, and it was not cured at all. And they were quite well to do at that time. And all types of doctors had been seen, Unani practitioners, homeopathy, allopathy, everything. But yet Ayurveda, yet no relief was given. And yet suddenly one day, the midwife who had seen his delivery, she came to meet his mother. And at that time, the young boy was just weeping in a corner. Normally he will come running to meet this lady. That day he was weeping in a corner, and she, seeing him, she asked his mother, what happened? And the mother gave this story that for the past 8 months, this boy has been suffering from severe stomachache and no cure. Then that lady told his mother, you send him to my house, my husband will treat him. And believe me, within, I think, 2 minutes, Guruji has told us that within 2 minutes, from a crying boy, he came to a laughing this thing. And he was explaining, oh, I am all right. I am all right. Main theek ho gaya. This was what happened. But all of us may have had some such experiences, but we don't convert it to a therapy. But because Dr. Mehra was a unique person, by the grace of God, he came to our country. Came to means he was sent by God, I mean, that way. He was an Indian only. So he was sent by God. I will put it that way only because that is how it happened. And then he started treating people. and the rest is history. So this application of pressure of 6 seconds has been devised by him, and where and how it should be done, all this has been devised by him. And by doing all this, we make dynamic adjustments, unlike certain medical therapies where the same tablet is taken for 1 week, 10 days, 15 days, 20 days, whatever. Here it is not so. I will give a treatment, and once the treatment has achieved its desired response, then that particular pain will go away, then some other treatment has to be given for the same person. Or 3 or 4 people, let us say, may have stomachache, but because of their constitutions, because of their other pain points, they may be given different treatments, even though all of them say they say they have stomachache or headache or whatever, joint pain, whatever, but they may need different treatments. So this is a very unique type of a therapy. And why? Because it makes dynamic adjustments. Because the patient's response to the treatment is what counts. Some people will respond faster, depending on their constitution, depending on the number of years the problem has been in their body, and some others may take longer time, etc. And by doing all this, we have a holistic impact. We see the body as a whole, because we are addressing the root cause of the imbalances. And thus, this therapy, Lajpatrai Mehra's neurotherapy, aims to enhance overall well-being without the use of medication. That's the beauty. So what conditions can this technique help to treat? Because it's a pressure application technique, and it can help to treat a variety of conditions by addressing imbalances in blood and lymph flow. Some of the conditions are digestive disorders. Is of course there, every type of digestive disorder, including severe constipation, loose motions, indigestion, etc. Then joint and muscle pains. We have relief for arthritis, back pain, and other musculoskeletal problems. Then neurological conditions, support for paralysis and nerve-related issues, even cases like Guillain-Barré syndrome, Bell's palsy. These are all common nowadays in many areas. We are having problems. This GBS, Guillain-Barré syndrome, was an outbreak recently, you all know, in several parts in Maharashtra. So even such cases we are able to tackle very well. Paralysis, etc. Okay. Then respiratory problems, asthma, bronchitis, cardiac asthma, all these things. Then circulatory issues, deep vein thrombosis, etc. Clots in this thing, coronary artery blockage, etc. In all that we are able to help. And mostly important thing to note is that this is tailored to the individual needs, which makes it versatile approach to holistic healing. So this is some of the introductory part about this therapy for the benefit of all. What are the specific benefits which we can give? The most important is it is a non-invasive healing process, because it does not require medication or surgery. It is a safe and natural way to support the body's natural healing process. Then it gives pain relief, improving blood flow and stimulating nerves. So it reduces pain and discomfort, and so is very beneficial in conditions like arthritis, back pain, muscle stiffness, cervical spondylosis, lumbar spondylosis, or spondylitis, etc. And improved digestion, of course, is the fundamental way. Okay. Then it addresses imbalances in the abdominal region, aiding in relief from digestive issues such as constipation or bloating. Then enhanced circulation, and by stimulating specific points, we help to restore proper blood flow and lymphatic flow. And by doing that, what happens? You get better oxygenation, you get better detoxification of the body, both of which are very important. And of course, next is neurological support, because it activates. We have a treatment called medulla treatment, which has been, various types of medullas have been shown by me in other classes also. We'll also be showing it here. So some of the important medullas, and that will activate the neural pathways, and it assists in managing variety of distinct disorders such as paralysis, nerve-related disorders, etc. And finally, all these things create a holistic balance. How? By aligning the body's systems, it contributes to a sense of overall well-being, making it effective for physical, mental, and emotional health. And the technique is extremely simple and focuses on harnessing the body's natural ability to heal. Focusing on the body's natural ability to heal. That is the fundamental point about this. Okay, so now we are talking of high blood pressure. What are the types of blood pressure? What are the types of BP which we should know about? Maybe many of you must be knowing, but still, let us see. What are they called and what are they classified, and how does neurotherapy come into this picture? So the first thing is, of course, normal blood pressure. You all know it is called 120 by 80. The 120 is called systolic and the 80 is called diastolic. So what is the significance of this pressure? It indicates a healthy blood flow. This normal 120 by 80 indicates healthy blood flow, and it causes minimal stress on the arteries. Because wherever there is a pressure, there will be a stress on the artery. So 120 by 80 is an average which causes minimal stress on the arteries. And by doing that, this 120 by 80, it maintains proper oxygen and nutrient delivery to all the organs. So that's it. So, and this is what we always rely upon. By correcting the blood flow from areas of excess supply to areas of deficit supply, we are ensuring proper oxygen and nutrient delivery to the organs. Now, for maintaining normal blood pressure, I am giving you certain tips. Simple tips, of course. Later, the more detailed tips will come. The simplest tip is keep a balanced diet, keep regular exercise and stress management. And next is limited sodium intake and stay hydrated. Now you will see later there are number of food products which are causing sodium increase in the body. So limited sodium intake. Limited sodium intake does not mean you don't eat salt at all. Okay. First of all, extra salt is not needed because many vegetables have natural sodium in some form or other, and that is good enough if it is reasonably steam cooked, not overcooked. Then that, and if the water is not thrown away, then that salt itself is sufficient for the body. Many of you may be knowing, all of you will be knowing, that when we give steamed food to small children, I'm talking of babies, 8 to 9 months or 1 year, whatever time they start weaning and eating a little bit of solid food, salt is not added. Even sugar is not added. The child is trained to take the food as it is. It should be. If somebody is adding sugar or salt now, it is not correct. Because the natural vitamins and minerals and natural salt which is there within the vegetable is good enough, so long as you don't throw away the water. That is good enough. But it's excellent. So that is limited sodium intake. Now, in modern days, we are unable to take that sort of what we will call as bland food. So we may add some salt, then we add some spices because we don't get proper hunger. If you have proper hunger, you won't bother about eating any spice, because spice is added only to make us eat better or eat more. Otherwise, plant food is good enough for our bodies, provided we are taking all vegetables, raw vegetables, etc., as they are, etc. So that is one thing, limited sodium intake. And then we should stay hydrated. Drink proper amount of water. This is the simplest thing to maintain BP. Now, after talking about normal blood pressure, we say nowadays there is another term which is called pre-hypertension. Like you have pre-diabetes. You have pre-diabetes, no, nowadays. So like that, you have pre-hypertension. Pre-hypertension is also blood pressure, elevated blood pressure, but it is not alarming. And what are the range? Normal is 120 by 80. This can go 129 by less than 80, whatever it is, 75, 70, 72, etc. But not more than 129. Then that is called pre-hypertension. And what is the importance of this? It is considered a warning stage. That means from 120 by 80, if you become 129 by 80 or 80 or 79 or whatever, then it's a warning stage that you are on the process of becoming a hypersensitive person. And why so? Because the arteries, I told you, the blood pressure is needed to supply oxygen and nutrients to the tissues. Now, when the blood is flowing in through the arteries, it is causing a certain amount of friction. And whenever there is friction, there will be a loss of elasticity. Whenever the friction will be more, there will be a loss of elasticity. And by that, what happens? The internal resistance through the tube, through the artery, that is called vascular resistance. The vascular resistance will go up. So arteries will lose elasticity and the vascular resistance goes up. And that is what maintains the higher blood pressure. Or rather causes the higher blood pressure. So for such a case, then here again, you will have to limit, or rather you will have to reduce the salt, whatever you take. The direct application of salt should be avoided. And also, salt is there in almost every processed food. Later on, if I have the time, I will give you a list of processed foods also. Salt is there in every processed food. So that should be limited, like papad, chips, all these things. So many things are there. Triumphs and whatnot. So all those things, they should be reduced. And then the most important, increase your physical activity at least 30 to 45 minutes, 5 to 6 days a week. 5 days a week is a minimum. 45 minutes workout 5 days a week. That will prevent you from becoming a hypertensive. And thirdly, very important, you must learn to manage stress and you must learn to have a proper sleep pattern. And this is where neurotherapy, we have got an excellent formula. That formula is called serotonin formula. I have given it earlier. I will be again giving it in this class. So by doing that serotonin formula, you will get a good sleep. To do it today with me, tomorrow you will say, yes, I got a good sleep yesterday, last night. So we'll do that. Okay. Then, does neurotherapy have proper protocols for pre-hypertension? We have got protocols for pre-hypertension, we have got protocols for hypertension, and also then another thing which is called hypertensive stress, which we'll see. So we have got protocols for that. We'll come to it later. Okay. Then Next one is high blood pressure. Stage 1 is 130 to 139. Earlier we were talking 120 to 129. That is pre-hypertension. Now you come to hypertension. They have got stage 1 is 130 to 139. Still not very alarming, but it is at least putting you over there, likely to. So here you will require a very exhaustive protocol. Okay, and systolic up to 139 millimeter of mercury and diastolic up to 89 millimeter of mercury. This is high blood pressure. 139 by 89. Actually, 89 is not at all desirable. The lower the diastolic blood pressure, as if it is nearer to 80, it is very good. We'll tell you why so. Okay. Then, okay. Then, what are the health risks? Now, I told you the arteries are getting friction. So, continued hypertension of 139 by 89 or whatever, it can cause mild to moderate damage to the arteries over time. Let us say 3 years or 4 years, 5 years. It will cause damage to the arteries. And by doing this, what happens? It causes increased risk of heart disease and kidney damage. Okay. Then treatment focus should be on lifestyle changes and wherever needed, possible medication. If you are taking neurotherapy, then maybe you may not require medication except in extreme cases, but some sort of a treatment is needed, either neurotherapy or medication, or in some cases both, depending on what is your hypertension level. So stage 1 hypertension was 139 to 89. Stage 2 is 140 mm and higher on the upper systolic side, and on the diastolic side 90 mm and higher. So that is real stage 2 hypertension. And here the serious concerns are that there is increased risk of stroke, paralysis, heart attack, and organ damage. See, here it is not only the blood vessels which are getting damaged. When you go to that range, 140 by 90 or higher, then organ damage is also possible or will start. So that is why it requires medical supervision and consistent monitoring. Now we have got neurotherapy protocols for this also. Basically, it will be the liver, and then we have got certain other treatments. So by doing all that, what we do, we are regulating what is known as the RAAS, renin angiotensin aldosterone system. Oh, don't worry. Nowadays, these are all known to everybody. A boy of class 12 knows all these things. So those of you who have not heard all these names, it is high time you should start knowing these things. The renin angiotensin aldosterone system. I will tell you in great detail what it does. What is its importance in creating, how it creates the high blood pressure. We should first know what causes high blood pressure. Up till now, I have been telling you what the blood pressure does, what all damages it can do. But we will also, along with learning neurotherapy protocols, we will learn what these RAAS is doing to the body. Okay. So we'll come to this. Then, so we came to two types. One was the pre-hypertensive. Then you have the hypertensive 2 stages. Then the real serious emergency situation, that is called hypertensive crisis. Hypertensive crisis. So pre-hypertension, then hypertension 2 stages, then hypertensive crisis. So these are the three types, let us say. And this is an emergency situation. And what does it mean? Systolic BP of more than 180 mm per mercury or higher, and a diastolic of more than 120. So up to 120 also diastolic one can tolerate. And in neurotherapy, we have specific treatments for systolic and specific treatments for diastolic. So don't worry. We'll see all those things by and by. But this systolic of 180 mm mercury or higher is a hypertensive crisis. Many people say 230, 220, that causes, that is real paralysis. Almost you are on the verge of paralysis. Okay. And it is a life-threatening condition. Right? Because it can cause stroke, it can cause heart attack, it can cause organ failure or brain hemorrhage. 4 things. Up till now, you had only 3. Okay, you had mainly organ failure. Earlier, it was the vessel failure, vessel getting damaged. Then it became organ getting damaged. Now you have got brain hemorrhage also possibility, especially if there is what is known as an aneurysm. An aneurysm in the brain. It means a slight dilation of an artery or a vein. Okay, that's called an aneurysm. For those of you who have males who know you have a cycle and you know it's a tire puncture is there, or a scooter, even motorcycle, of course, the tube gets slightly bloated in one place and then it develops a puncture over there. That same thing can happen in the body also, and that is called an aneurysm. So it can cause brain hemorrhage. And what is the solution? Immediate medical intervention. So at that time, we don't even give any treatments when such cases. Of course, if person is a younger age and if he doesn't have any major problem, then we can treat such 180 by 120, we can treat and immediately it comes down. But if it is an emergency crisis, hypertensive crisis, then it requires immediate medical intervention. And what are the symptoms? Because it is a fluid buildup over here, there will be severe headache, very severe headache. There could be chest pain, depending on if it is a heart problem. There could be shortness of breath, inability to breathe. And then in serious cases, there could be blurred vision, nausea, that is throwing up, and confusion. When you have so much problem, then naturally there will be confusion. So in such cases, the support neurotherapy gives is usually post-crisis support, because such cases are immediately normally attended to in the hospitals. But after coming from the hospital, we have got post-crisis support. And what we do, we stabilize the autonomic function, we streamline the circulation, we ensure free urine flow, and together all these things, they support kidney detox and fluid regulation. Okay. So now let us talk about the renin, angiotensin, aldosterone system. Now it's only 8:40, around 9 or so, I will start the treatments, 9 or 9:05, whatever, because a little bit of theory is needed for us to understand why our bodies are getting high blood pressure. What is it causing the blood pressure? Is it a fault? Is it a protective measure? What? So that we will see. And for that, the answer lies in what is known as the renin, angiotensin, aldosterone system, RAAS. Sometimes it's also called RAS, renin angiotensin system. Okay, aldosterone word may be there, may not be there, but it is the same. So what is this RAS? So the renin angiotensin aldosterone system, it is a hormone system. And a hormone system means it works like that, within seconds, within fraction of a second. What it does, it regulates the blood pressure, it regulates fluid balance, it regulates electrolyte balance. So three things: blood pressure, fluid balance, electrolyte balance. And by doing all this, it plays a critical role in maintaining blood volume and vascular resistance. Vascular resistance means what? The resistance through the arteries, through the veins, the flow of blood, resistance to the flow of blood. So how does it work? Number one, what triggers it? Low blood pressure or low sodium. That means a person is taking too less salt, too less for his needs. And what is too less for the needs? You are perspiring profusely and still you are not compensating for it by taking some salt. And it should be natural salt, that is some raw vegetables you can take, etc. Okay. So then if that happens, the kidneys detect this low blood pressure or low sodium level. Another thing, low blood pressure can be caused because of some sudden loss of blood. It could be due to dehydration, it could be due to loose motions, or it could be due to sudden loss of blood through anything. It could be a miscarriage. For ladies, it could be a miscarriage or excessive bleeding in menses, etc. In all these cases, the body detects, the kidneys detect the low blood pressure and immediately they compensate because they release this renin. Renin is an enzyme which is secreted by what is known as the juxtaglomerular cells, JG cell. They are in the kidney. They are just over there. We have in the kidney a filtering system that is called the glomerulus. It is something like this only, like that, like a cup. Okay. Then through that only the filtration process happens. And this glomerulus, the cells in it is called juxtaglomerular cells. They have the capacity to release this renin. And they will release renin whenever they sense a lowering of the pressure, because their job is to filter the blood. So when for filtering blood, you require proper pressure of the blood. When the blood pressure is low, as I said, the causes are that low loss of blood, loss of water through the body, either through dehydration or through loose motion, etc., vomiting. So by all these things, when you are having this problem, then the body compensates, the kidneys compensate by secreting renin. Then immediately this renin, when it comes into the blood, in the blood, there is already an enzyme. So there is a protein, which is called angiotensinogen, which is produced by the liver. The liver is producing this angiotensinogen. And that angiotensinogen is converted by renin to another form that is called angiotensin 1. Now, you don't require all these so much, but you should understand that we have gotten treatments for all these things. That is why I am telling you in greater detail. And we are using this body's conversion process. We are using our own techniques to simulate this body's process. And so we are combating or counteracting the effect of all these things by neurotherapy, without medicine. So that's why I'm going about these things. Okay. Then this angiotensin 1 gets converted to angiotensin 2. In the lungs, there is an enzyme. In the lungs, especially the apex of the lungs, there is an enzyme called ACE, angiotensin converting enzyme. The renin converts angiotensinogen to angiotensin 1. The angiotensin converting enzyme in the lungs, it converts this angiotensin 1 to angiotensin 2. Why? Because angiotensin 1 is a very, very great potent vasodilator, a vasoconstrictor. Vasoconstrictor means it constricts. Angiotensin 2 is somewhat better. It is not so drastic. So the body quickly converts it. Angiotensin 1 to angiotensin 2. Okay. And this angiotensin 2 is from the lungs. I mean, it gets converted in the lungs, and then this given in the blood. Okay. Now, what are the effects of this angiotensin 2? Okay, 1 minute. Okay, to continue. So, effect of angiotensin 2, it has got two effects. Number one, it's a vasoconstrictor. Vasoconstrictor means it narrows all the blood vessels immediately, all over the body. That is a beauty. It doesn't act in only one place. All the blood vessels in the body, they get narrowed naturally, blood pressure will increase. Then it causes another chemical called aldosterone, which is another hormone. This aldosterone is from the adrenal glands. So the adrenal glands produce this aldosterone, and that is adrenal also. It has got, the adrenal gland has got a medulla and a cortex. Cortex is the outer part, medulla is the inside part. So the outer part, medulla, the cortex, that is what produces this aldosterone. And this aldosterone, what it does is it has got a control over the kidneys. Now the kidneys have, normally they are allowing urine to go away now. Now, under the effect of aldosterone, the kidneys will hold water and salt, because salt cannot go by itself. It has to go through the water. So whenever the kidneys will hold the water, salt also will become higher in the body. That means by these two methods, the salt level in the body, sodium, that is, the sodium level in the body will increase and the blood volume will increase. And that is how it immediately. Now you are already having a constriction of the blood vessels, and this will cause an increase of blood pressure because the volume is increasing. So by doing all this, the blood pressure increases. And this is normally a corrective mechanism to prevent low blood pressure. This renin-angiotensin system is actually a system of the body, a protective system of the body to prevent low blood pressure. It is not really causing high blood pressure, but it is causing high blood pressure because the kidneys are having this control and they are not getting proper pressure for doing their job of filtration. So by all these things, what is happening? It is restoring the low blood pressure to normal and thus bringing the fluid balance. Now, how does this RAAS, how does it contribute to high blood pressure? This is where our understanding, this thing is important. How does it contribute to high blood pressure? Okay, I understand that it is normalizing from low blood pressure, it is normalizing. But then how does it become higher blood pressure when it is not functioning the proper way it should? Persistent activation of RAS can lead to chronic vasoconstriction and fluid retention. That means when this RAS is persistent, constantly acting again and again, then what happens? It causes chronic vasoconstriction, it causes fluid retention. And that is how it is causing sustained high blood pressure. So that means it is an anomaly. And neurotherapy, we are able to bring it back to normal. And one of the processes is aldosterone. When it causes increased sodium retention and water, the blood volume goes up so much that is increasing the vascular pressure. And angiotensin 2 has got another effect. It promotes inflammation and oxidative stress. So that is where the problems all arise. Angiotensin 2, because any hormone will have some negative side effect. Though this is the hormone made by the body, it promotes inflammation and oxidative stress. And that is why we use a treatment called 6-ADR to increase cortisol to reduce this inflammation. So what happens due to this inflammation? What does it cause? It causes stiffening of the arteries. Now the artery, when they have to constrict and expand, they should be elastic. Stiffened arteries will not be elastic, and stiffening of the arteries increases the blood pressure higher than it was normal, than it was earlier. So it is like a vicious cycle going like a positive feedback, keeps on increasing. That is how once the blood pressure goes higher, it keeps on going higher. And that's all because all these things are not under control normally by the body, by that body. So then what we do, we regulate kidney filtration, we regulate RAS response, and then we have got a treatment called 30 medulla, which decreases the blood pressure substantially. Then we have got a treatment called 1-point liver, and that also stabilizes the work of the kidneys. And then we have a treatment which opens up the vascular, the constriction. It opens up, it dilates the blood vessels. We have a treatment to stimulate the vagus nerve, that is called 10 medulla. All these things we'll teach you. I'm just telling you how systematically we are going about, and what are the ways. This is not a one-off class. I don't intend to kind of finish everything in one day, because the subject is vast. You must first understand the subject. Just taking the treatment alone without understanding the logic is not good. I can just go on giving you all the formulas. That doesn't help. I want you to understand the logic of all these formulas. Our Dr. Mehra, he has spent 7 decades, 70 years of his life, more than 70 years of his life, he has spent in formulating all these things so systematically. And so all of you should understand. I want you to understand the logic behind everything that I give, so that then you will be forced or inclined to try out my treatments, and then you will be successful. Okay. So now we have got treatment to improve. It's called P heparin, which I'll be teaching. We have got treatments to improve circulation, and that immediately reduces the diastolic BP. So we have got 30 medulla, which decreases systolic BP. We have got P heparin, which reduces diastolic BP. So we have got treatments for both. In general, this works. There may be 1 or 2 people who may not immediately get results because there is a chronic case, but in general, it works. Okay. Then by doing all this, we have got kidney clear formula, etc. Then we activate the sacral region. By doing all that, it enhances the detoxification function to reduce the fluid overload. I told you fluid overload happens. It reduces fluid overload and thus manages high blood pressure. Okay. So what are these things? Problems of RAS is just a recapitulation: chronic kidney disease, heart failure, metabolic disorders. These are all some of these things. Overactive RAS, the results of overactive RAS is chronic kidney disease, which happens in the case of diabetics, heart failure, and metabolic disorders. That is why it is essential to manage high blood pressure effectively without medicines. Okay. Then we also have treatments for chest burning situation, for loose motions. Many of the people have loose motions and body swelling. For all that we have treatment. Okay. So now, yeah, it is now 9 p.m. going to be 9 p.m. 1 or 2 minutes. So we will now start with the essential treatments, whatever are needed for today. I have got more theory, but I will keep some of it for next day. Then we have got a questionnaire for you to understand what are the things you should learn. So we'll see it either today or tomorrow. Let us first see a little bit of practices, simple practices. So easy to follow for anybody. So we start. Actually, the first treatment we need is called 8th medulla. What is 8th medulla? 8th medulla is, according to our neurotherapy, it produces a chemical called serotonin. Now, many of you may be knowing what is serotonin. I have seen in the group also it has come. Okay, you must have read it. Serotonin is a neurotransmitter which is a calming agent and which promotes sleep. A neurotransmitter is a calming agent and it promotes sleep. So this is the easy technique for anybody to do. And why it is given in the beginning? Because almost all hypertensives, I assume in this class, hypertensives are maximum in this class. So there are only 75 people or so. Okay, barring myself and Anusha ji. Okay. Still, I believe, I hope, or I think at least out of 75, at least 65 people will be really having high blood pressure. So for them, immediately they can get benefit. First treatment, which is useful for anybody, whether you have high blood pressure or not, you will benefit by serotonin. And serotonin has got 2 or 3 versions. One is a longer version. Right now, I am taking you through the very simple and short version, and that is called 8th medulla. And normally we give it thrice. 3 times when it is given, it works wonders. I remember in one of our diabetics classes, one lady actually confessed in the group that while you are doing, say, 8th medulla, I did it for myself and I did it twice, I think, and after that I do not know what happened. And she got up much later. Of course, it happened same way even in our Guruji's clinic and Dr. Mehra's clinic. The patient on whom it was first administered, she slept over there on the spot while the treatment was being given. Of course, right now I am showing you the treatment in sitting position. She was given the treatment in lying position. She just went off to sleep. Okay, so that is how powerful it is. 8th medulla for serotonin. Okay, how do you do this? Very simple. I am using, first I am going to show by one finger. Okay, and really, if you want good results, you should use 2 fingers. Okay, but I now show one finger. It is easy. I will show you both versions. Okay, so one finger, we always start in neurotherapy, almost every treatment with except some some exceptions. It starts on the left side and goes to the right side. This is my left side, this is my right side. Okay, so left side we start. How do I start? Very simple. Where do I give treatment? Don't do it now. First see where. For those who know, you can do it if you like, but those who do not know, please see how and where I give. See, you see over here, this is the bone. This is the bone. This is the ear. Outside, just outside the ear, you have the bone. From there, just below the bone is a fleshy area. I am not, this is the bone. See, this is the bone. I finished. End the bone. This is the fleshy area. From there, vertically down, I have to come. Vertically down, I have to come. Vertically down. Okay. So now, for the time being, I will show you in another camera. Just for some seconds, you will see another camera. Let me see if I can. This can be spotlighted. Yeah, this can be spotlighted, I think. Add spotlight or rather replace spotlight. Okay. So now very easily you can see. Okay. So now you can understand, very simple. Now you see, I am going to use this finger like that. I am going to stroke. You see from here, I am going to do 16 times. 8 medulla means 8 pairs. That is 16 times. Okay. So now let us see how to do it. 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15, 16. And at 16th time, I just hold it for a few seconds, 2 to 3 seconds. I hold it and slightly shake the area so that whatever I have pulled down should not come up. So this is 16 on the left side. Now we'll go to the other side, the right side. Okay, this is the right side. Now again, I will do 16 on the right side. Now here I am going to use 2 fingers like this. So that means I will do only 8 pairs. Though I will be counting 16, I will be doing 8 pairs. So please see how it is done. 1, 1, 2, 2, 3, 3, 4, 4, 6, 6, 7, 8, 8. This is 8 pairs, also 16. So, okay. So with that, we have got now 8 medulla means if I do it with single finger, I do 16 times. If I do it with 2 fingers, I do it 8 times. Okay. So 8 medulla means 8 pairs. Understand? And we start on the left side of the neck and then go to the right side of the neck. So left first, right later. So that is 8 medulla. And normally we wait for 1 minute and we will repeat it one more time. Now this time, those of you who have followed me well, you can do it for your own, on your own. Okay, you can do it with me. I'll be doing it slowly. But get the hang on the counting. You should count correctly. You should not make mistake. Because we have got medulla from 1 to 12. 1 medulla to 12 medulla. They all work differently. It is unbelievable, but it is true. 1 medulla, 2 medulla, 3 medulla, like that. So if you make a mistake in counting, you won't get the result which you want. You may get some result, no doubt, but not the result which you want. And now the result what we want is 8 medulla for serotonin. And so for that, please count correctly. Look at me. I have already shown you one demo earlier. Now I will be showing another demo. Now this time I am going to use both fingers and we will be doing one first on the left side, then on the right side. Okay. So now let us start. We'll start on the left side. And later on, after this, if anybody wants to verify whether you are doing correctly, we will give you time for that also. Okay. So you can, anybody who wants to be corrected or to know whether they are correct, they can raise their hands after about another 2 minutes. So let us see Now we go to 8th medulla, first on the left side. Okay. Now you see, now I have removed one earphone so that you can hear me somewhat. Okay, let us start. So in this, what I do is I keep one finger here and one finger here. So when I come from here to here, then I take this finger and go from here to here. So one finger up and one finger down, one finger comes down, then the other finger comes down. Then 1, 2, 1, 2, like that. Okay. So now you see, all of you. Let us start. So I have kept one finger here, 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8. Hold there for a few seconds, please. Please hold. Hold for a few seconds. You can shake it slightly, shake the area. So that was 8th medulla on the left side. Okay, now we go to 8th medulla on the right side. Okay, now here we go. Okay, now we start. Again, I am keeping one finger down, one finger up. I am going to come from here. Watch me, I am going to do it slightly slowly so that you can follow properly. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8. Like that, press for a few seconds and leave. So that was 38 medulla on both sides. Okay, now we will unglued this. Okay, fine. Now, if anybody wants, nobody has raised their hands. Okay, that means everybody is comfortable with whatever I have done. That is nice. Okay. If anybody wants, you can always raise your hand, and then I will give you the chance to learn. So this was 8th medulla. Then between systolic and diastolic, the one which is more important is called systolic pressure. Is diastolic pressure. Sorry. The one which is more important, which has to be kept under control, is diastolic pressure. Why it is diastolic pressure is important? Because diastolic pressure is the pressure when the heart is resting. Systolic pressure is the pressure when the heart is pumping. And in that pumping also, though it is simultaneously, the left side pumps to the entire body. That means left side has to pump much more effectively. The right side pumps only up to the lungs, which is very near from heart to the lungs. Here only it is pumping, whereas left side has to pump the whole body. Okay, so the left side has to work really hard. So now we will teach you a very simple treatment for reducing systolic blood pressure. And this treatment can be done by everybody because it not only reduces blood pressure, it also improves the blood circulation to all organs. So all the oxygen and nutrients for all the organs, they are very well done. Okay, so that is how this is working. And it contains only 3 points. 3 points. Rather, 3 types, let us say. One is over here. It is called 8-pan. 8 times I will press in one location. I don't move my hand anywhere. One location I press 8 times in a particular fashion. I will also show you. And then we'll do together 8-pan. Then the second one is called 7-liver. In 7-liver, 8-pan we are giving in the same location. In 7-liver, we will giving in 3 locations. 1, 2, 3. And simultaneously 1, 2, 3. only on the left side, not on the right side. No, not on the right side. It's only on the left side. Okay, this is the left side. So this is the second location. And the third location is over here in the chest, just like this. We have to raise our hands like this and then stroke mildly. Now I'll show. Please wait for 1 second. Don't do it now. I will show the first one. I am keeping a hand like this. So all of you just keep your hand gently over here like this. Okay. Gently keep your hand. And you are pressing like this, not like this, not inwards. You are pressing vertically down on the groin, on the thigh. We are pressing on the thigh where it meets the hip. That, how many times you have to do? We have to give 6-second pressure for 8 rounds. 6-second pressure for 8 rounds. Okay. So 6-second pressure in the same location. Every time I will be pressing and removing, again pressing, removing. But each time the pressure will be held for 6 seconds. And I will do so 8 times. And because the pressure is to be given here, so I will slightly lean forward like this. Understand? And you have to put downward pressure. And slightly, you slightly give like this. Don't go outside like this. Don't keep pressure like that. Keep pressure inwards. Simple. Very simple. Okay. And those of you who cannot sit like this, I am sitting in a divan type. No, I'm sitting like this. You can sit in a chair and do the same exercise. No problem. Keep your legs downwards. You don't have to keep your legs folded like this. You can keep like this. Those of you who are sitting on a sofa or any soft yielding place, please come out of that region. That is not good for this treatment. You require a hard support here. You require hard support. So it can be a chair, it can be a bed, and even in the bed, if you are not comfortable with folded legs, you can put your leg in front of the bed. Okay, understand? So anyway, you can do it. I have given you all the possible options. Achha, another thing, some people may be able to sit like this, but maybe their leg is like this. You are quite comfortable sitting in bed like this, but your leg is like this. In that case, I tell you, please keep 1 or 2 pillows here. That also is good. So that also option is there. If you don't have to sit on a chair, you can either sit in the bed and then put your legs down, or you can sit like this as I am sitting, put a pillow over here, thick pillow. It should not be very soft, yielding pillow. It should not be there. So it's thick pillow is there so that when I'm applying pressure like this, it gives me support here. The pillow supports me here. Okay. So all these options are here. So let us now start the treatment. 8 times in the same location, in both groins, vertical pressure. Okay. And how I am giving the pressure? I am giving the pressure with the inside of my palm here, this portion. Not here. Not here. I don't press like this. I press like this. I press with the inside of my palm, with this portion. Okay. So with this portion, I am pressing vertically downwards. Now we'll start. Okay. All of you start with me. Keep your hands vertically down, slightly lean forward. 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Slightly lift up immediately, same location. 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Lift and release. Gain 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6.
Sir, use
Fourth
the
round.
other camera, please.
Pardon?
Use the other camera, sir. This is small, right?
Okay.
Yeah.
Oh. No, I am using that camera. 1 minute. All right. Achha, this is the distance camera. Okay, you want the smaller one, other
Yes.
one. Wait. Yeah, let me see.
The first camera which you used.
Yeah, but I was using that only.
No, for medulla, you use this.
Okay. I have not. Sorry. Yeah, you're right.
Yes, sir. Thank you.
Thank you, Pika. I'll do it again. Okay, sorry, I didn't realize, my mistake. Please 1 minute, I'll just drink some water. Oh. Okay, so now 8 times I am giving pressure for 6 seconds in the same location. I am leaning forward every time. So we start again. It doesn't matter if those of you who have done 1, 2 times, it does not matter. PAN is quite a very simple treatment. It can be repeated also, no problem. Okay, now we'll start again. Okay, here we are going to go slightly inwards. We have to press inwards. Okay, now lean forward. 1 1 1 2 1 3 1 4 1 5 1 6. Same location. Lift 2 1 2 2 2 3 2 4 2 5 2 6. Same location. 3 1 3 2 3 3 3 4 3 5 3 6. 4 1 4 2 4 3 4 4 4 5 4 6. You should lean forward a little bit. 5 1 5 2 5 3 5 4 5 5 5 6. 6 1 6 2 6 3 6 4 6 5 6 6. 7 1 7 2 7 3 7 4 7 5 7 6. Last 8 1 8 2 8 3 8 4 8 5 8 6. Okay, then the next is the liver. So left hand, my left hand, I am going to keep it like this, perpendicular to the thigh. Okay, and then 3 locations immediately. Okay, well, total 7 locations will be there. So 1 2 3, and the bottom of the hand, this bone, that will press down here. First location, second location, third location. Third location will be near the kneecap, but not on the kneecap. It will be slightly before the kneecap. Okay, so let us start. Liver. This is called liver point. 7 liver. So lean forward, pull inwards a little bit. 1 1 1 2 1 3 1 4 1 5 1 6. Then get up, keep the next one, pull inwards. 2 1 2 2 2 3 2 4 2 5 2 6. Release. Third location, again pull inwards. 3 1 3 2 3 3 3 4 3 5 3 6. First location again, 4 1 4 2 4 3 4 4 4 5 4 6. Middle location, 5 1 5 2 5 3 5 4 5 5 5 6. Then last one, 6 1, sorry, not last, 6 1 6 1 6 2 6 3 6 4 6 5 6 6. Then finally 7 1 7 2, that is in the middle, 7 3 7 4 7 5 7 6. So we did 7. Then slightly lift your hand. This is the left hand. So from the left side of the chest, I'll have to stroke upwards 12 times. Stroke upwards. 1 2 3 4 6 7 8 9 10 11 12. Then this side again. 1 2 3 4 5 6 7 8 9 10 11 12. Again this side. 1 2 3 6 7 8 9 10 11 12. Again here, last. 1 2 3 4 5 6 7 8 9 10 11 12. So these are 3 points. 8 pan, 7 liver, and this is called 8 chest only. 12 12 12 12. So totally it is 24 per side, but it is to be split 12 12 12 12. Okay, so these 3 together, this is called P heparin. These 3, 8 pan, 7 liver, and this 12 into 4, P heparin. You should remember this name because I will be using this term pre-heparin now for my next classes. If I say pre-heparin, you know what is the treatment. Okay. So first we did 8 medulla, that is for calming the nerves. Then we did pre-heparin. Then this liver point which we did here, that has got another different type of application. That is also very beneficial for BP, blood pressure. So that also I will be teaching you. But before that, I'll teach you another point which is very simple. It is addressing the Vajra Nadi. All of you know what is the Vajra Nadi. The Vajra Nadi is related to the digestion. It is related to the strength of the nerves. And so, and where is it coming? It is coming over here in this, the big toe. The big toe, if you can see, it will be just like this. Actually, we are stimulating the Vajranadi when we are sitting in Vajrasan. That is why it is called Vajrasan. Vajranadi Asan. It's called Vajrasan. All of you know what is Vajrasan. And what are we doing? We are stimulating this Vajranadi. Now, by sitting in Vajrasan, we can do it, but this is in neurotherapy, we are doing it slightly different. What we are doing is we are just keeping, I am just showing you first one finger, one leg, the left leg. Then I'll show you together. Actually, we do it together. We do it together, but I'll show you first for the left leg. What I am doing is I am keeping my other hand, I mean this thumb, I am keeping it here. Okay, I am keeping it here on the sole, on the sole over here I am keeping. Okay, the thumb. And this with this other first finger, I am just twisting it slightly. And now I am going to pull this Vajranadi right from here, the ankle, from the shin bone. From there, I am going to pull it right down, 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 and then coming up to the nail. You know, this is the nail. Just over there, I bend it downwards. And I hold there for 6 seconds. So this is how I'll do. I'll first do with one leg, then I'll do it with both legs. And with both legs is what you have to do. But just to follow properly, you can understand with one leg. Okay. So now we have got this thing. Now other finger I am keeping here. And this finger I am not moving much. This finger I won't move much. I'll just move it a little bit. But this finger, this finger, I will move it from here all the way up to here. And then I will do it down. Okay, that's all. So now let us see. All of you understand? Now I am keeping this slightly twisted. Okay, and then going slowly, going down, going down, going down. And then slowly, when I come here, I am catching with both my fingers. 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Again, going back. Same way, 1, 1, like this I go. Then I go 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Then the third time, slowly, with real force you should do. Then come down, 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. Now, this was for the left leg. Now we can do the same thing for the right leg. Okay, same way, I keep this finger here. And as I am bringing this down, I am bringing this, both the fingers, and then I am coming up to here. See, like this, I am coming. I am coming like this, and then I will do that. Okay, now how do I do? Same way, I come down, give pressure, slowly, like this, I come, I come, I come, I come, slowly I come, and then 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Again, next one, 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Third one, 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. Now a question will come that those who cannot bend their feet like this, what can they do? They cannot do it with their legs hanging down. It is very difficult. You cannot bend forward and do it so easily. So you have to somehow, you can keep 1 or 2 pillows here so that you can be like this, and then you can do. And those, as I said, if you can keep 2 or pillows here, then I'll teach you a very simple method by which you can do this simultaneously. Take like this. Again, same way I am doing. This come down, and then here I am bringing it pulling it down. 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Then 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. Okay, 3 times if you do also, it is enough. You can go do even 9 times. You will say, how to know whether I should do 3 times or 9 times? Very simple. Now here, this is our chest bone. We all know sternum. All of you know it. Now just where the chest bone ends, just where this chest bone ends, this is the solar plexus. Just below the solar plexus, to touch and see, for some people, if I am applying just gentle pressure and pressing in and out, in and out, for some people, there will be too much pain over there, over this region. And where is it? This is approximately from the navel, between the navel and the solar plexus. You know, you can, if you divide that region into 3 parts mentally. So, 3 parts mentally, if you divide the first two-third part, that is the pain which will be released by this treatment. And this treatment is called CNNS gas. Gas means because it is related to gas of the stomach and gas of the intestines. The left leg is concerned with gas of the stomach. The right leg is concerned with the gas of the intestines. That means it will reduce. Whoever who is having gas in the stomach, they will have a lot of belching. This treatment will reduce the belching. Then some people may be having flatus, gas from the intestines coming out from below. Then for them, by doing this regularly, that problem will also be solved. So that is why it is called CNNS gas. Okay. CNNS gas. That's all. There is another treatment called gas, all 3 sides. I am not showing that now. This is enough. CNNS gas. This itself is good for high BP. Okay. We'll come to more about it later. So CNNS gas, you first do 8 medulla, then do CNNS gas. You can do this as a regular routine. Every day, early morning, you can do it. Yeah, then your BP will not, that fluctuation also will come down. Then after that, you do this liver in another way. I showed you liver 7 in one place. Now you will do liver in another way. It is called 1-point liver. 1-point liver into 6. 1-point liver into 6. How do you do it? Very simple. Same way you have to do, but only you have to give a gap of 1 minute, approximately 1 minute between every treatment. So how do I do? Same way, I give liver first. This is 1-point liver into 6 treatments. I give liver first. First I give liver. Okay. How do I give liver? Again, I will pull inwards and I will press with my hand here, and this hand is going to press here. So same way, I will press inwards, pull inwards, 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Wait, that's all. This is called point liver. That means 1 point at a time. Then you have to wait. At least for about 30 to 40 seconds, you must wait. And normally I tell people, if you are really very serious, just do 1 or 2 or 3 rounds of Nadi Shuddhi Pranayama, Anulom Vinom, alternative nostril breathing. Do 2 or 3 rounds. Okay. So let us just do for at least 1 round. So I did 1 round. Anybody doing more? Also, you can, till you finish your round, you can wait. Okay, then we can go. So this was first point I gave here. Now the second point. So where is the second point? First was here, second is here, middle of the hand, and here middle of the thigh. So again, pull inwards. 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Again, Nadi Shuddhi Pranayama. So this was the second place. Now third place. Third place is 1, 2, 3. This is third place. Very close to the wrist. And here very close to the elbow, but not on the elbow. I mean, very close to the kneecap, but not on the kneecap. Okay. So again, pulling inwards. 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. You just require moderate pressure. For people who are having serious liver problem, they can do instead of 6, they can go to 12. Here also 12, here also 12, here also 12. 12 counts. Okay, 12 seconds. Okay, that can also be done. But minimum 6 seconds pressure. So then we have done that. Now again, one round of Nadi Shuddhi Pranayama. Now I've been speaking, so that itself is enough. Some time gap has been given. Okay. So after the third one, fourth one, again, it has to come to the first location. The first location, again, I have to keep my hand like this. And then again, I have to pull inwards. So press, pull inwards, 4, 1, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6. Again, Nadi Shuddhi Pranayama, let us do. So that was the fourth round over. Now fifth round in the middle over here, middle, and then again pull the middle. 5, 1, 5, 2, 5, 3, 5, 4, 5, 5, 5, 6. Okay. So now the last one. This is called 1-point lever. And when we finish the last, it will be called 1-point lever into 6. Okay. We use 1-point lever into 3. That means 1, 2, 3, or 1-point lever into 6. Both are used now in this practice. Okay. Okay. So we'll teach. I have taught you 1-point lever into 3 already has been taught. Now 1-point lever into 6. So now let us go to the sixth and final location. Pull inwards. 6, 1, 6, 2, 6, 3, 6, 4, 6, 5, 6, 6. Okay. So it was 1-point lever into 6 treatments. Very good for handling high blood pressure. So what all we did? We did 8 medulla. Then we did CNNS gas. This one, we did that. Then we did 1-point lever. And we also have done P heparin earlier. That is 8 pan, 7 liver together, and then 12, 12, 12, 12. So all these treatments, even if you do this much, your BP will start getting under control. Okay, maybe not completely gone, but it will get under control. Take it. So now that is around 9:35. Now, if anybody has any questions, etc., you can ask. Anything to be repeated. Otherwise, I will go for some theory. Okay, nobody has raised any hand. I think it is too simple and many of you might have come earlier. I see.
If you have any doubts, please raise your hands now itself.
Yeah, if you have any doubts.
Please switch on your videos.
Yeah, but quite a number of people, new also are there, and old people also are there. I see quite a number of new people are there. So very good. And old people also are there. Very nice. So I'm happy that it's a mixture and many more new people have joined. So if any of you want me to repeat any of the treatments, please ask. Since, as Madam has said, this is a free class, so we won't be giving any this thing. But still, I'll be supporting you in whatever way you want. And yeah, Madam, Anita Madam has raised her hand. Yes, Madam, please go ahead. Yeah, I can't hear you.
Hello, sir.
Yeah, yes,
Can you
yes.
hear me? Good evening, sir.
Good evening.
So after COVID injections, no vaccination, I have started having the blood pressure. Okay, sometimes it will be around 140 and 100, and now sometimes it rises up to 160.
What is your
And
age?
53.
53. Okay. 53 means even 150 you need not bother, but 140 we will try to maintain. At 140, don't try to maintain 120 by 80. Even if
Okay.
you are having any medicine, if it is coming down to 120 by 80, that is not good for your age. For your
Okay.
age, 145 or 145 itself is okay, but maybe if you want, we can go up to 140. And for
So what can be done for water retention, sir?
wait. I'll come. Yeah, I'll come for water retention. Number one, now because you got this problem after COVID, we call this side effect of something. It can be side effect of the vaccination, it can be side effect of the virus, whatever. For that, the best treatment, really good treatment, it is called 30 medulla. Now you saw 8 medulla. Now instead of 8 medulla, if you do the same thing, 30 pairs, in the left side, 30 pairs on the right side, you can repeat it after a while. If necessary, after 2 or 3 minutes, you can repeat it. You will see that itself brings down your BP a little bit. So you please start doing it from tonight. I think by tomorrow morning, by tomorrow evening or day after tomorrow morning, there will be some reduction in your BP. Because we have seen this 30 medulla works wonders wherever this side effect of medicines or side effect of virus, etc. is there, it works wonders. And we have seen the result earlier also in diabetic class. 1 or 2 people had some problem, and then I told them 30 medulla and they got benefited. So it is a good thing. So that is number one. Now for water retention. Now for water retention, what we have to do is we have got something called kidney clear treatment. And also this 2 pan into 6, there is one treatment. Now I will, because it is still nobody else has raised the hand, I will do this treatment. It's very nice, very effective treatment and good for everybody. So anybody who is not having the water retention problem also can do it, because it helps to clear so many things in the body. It helps to clear small blockages, etc. 1 minute. Yeah, it helps to clear small blockages, etc. Okay, so how do you do this 2 pan? 2 pan into 6 is very good for you for water retention. Then I will teach you another small exercises to be done lying on your stomach. By you, it can be done. That also helps in water retention. Okay, so let us see how this 2 pan is to be done. So pan, as I told you, is given over here. Okay, so all that you have to do is you can do this sitting on a chair. Okay, all that you have to do is just like this. Okay, same 2 pan, just what we did now. Now 1 1 1 2 1 3 1 4 1 5 1 6. Again 1 1 1 2 1 3 1 4 1 5 1 6. Actually, it is 2 pan. 2 pan 1 time I have done, so that is why I am counting it as 1. Now we will wait for 1 minute, or let us say we'll wait for about 15 seconds. So we can normally we wait for a minute, about 45 seconds we wait. Okay, but now for the time being, we'll wait for it's about 15-20 seconds. And while I am talking itself, some time is going away. So that was the first time. Now second one. 2 1 2 2 2 3 2 4 2 5 2 6. Again 2 1 2 2 2 3 2 4 2 5 2 6. So this was second round. Again we wait for about 45 seconds or so. Okay. We have to do this whole sequence has to be done 6 times. Okay. That is total, that's all. And like that you will do every 3 hours. Then by tomorrow evening itself, you will see much of your water retention problem has reduced.
Okay.
Okay. And it also, in case you are having some swelling in the feet, etc. That do you have swelling in the feet?
Yes, sir. When I
The
stand
both
for a
feet.
longer time, I'll be having it.
So no, that is the different problem.
Oh.
Okay, I mean different problem means it is also this treatment also will help, but you also require to give p heparin, the treatment which I showed
Okay.
earlier. No,
Yeah.
you require to give that along after this doing this 2-pan. Now I did 2-pan 2 times. I will do third time. 3-1, 3-2, 3-3, 3-4, 3-5, 3-6.
Okay.
3-1, 3-2, 3-3, 3-4, 3-5, 3-6. So another 3 more to be done. I'll do it because it will help you to put it in your memory. So this P heparin treatment, which I showed earlier, that has to be done along with this after this.
Okay.
If you do this by tomorrow, if you do this about 3 to 4 times, by evening, you should have substantial results. And then I would request you, and you and Anusha madam is telling everybody, please immediately write your result.
Feedback.
If you get even a little bit reduction, how do you know reduction? Just take a tape and then measure it. Wherever you are having fluid retention, that one you place, whichever is the maximum fluid retention point, there you take a tape and measure it. It can be here or it can be here, higher, wherever it is there. You measure it and then put it write in a notebook, say 7 mm, 10 mm, 15 mm, whatever. Then after doing for 4 rounds or 5 rounds, you measure it. Even if it comes down by 1 mm, that means 1 square kilometer of water has gone away. Because you see, it is everywhere. 1 mm means 1 mm thickness means everywhere it is working. No, so it will be a lot of water will be helped. So that way you can get a lot of benefit. So now that was 3 times is over. 4th time, 4-1, 4-2, 4-3, 4-4, 4-5, 4-6, 4-1, 4-2, 4-3, 4-4, 4-5, 4-6. So that was 4th round. Even here we can do Nadi Shuddhi Pranayama. Everywhere we can do Nadi Shuddhi Pranayama. It is very good alternative nostril breathing. But you should not at this time, you should not in between watching the TV and or mobile and all that. That is what we all do. So most of us will do 1 minute or we'll say we'll watch and send one message. This should be avoided. For this six rounds when we are doing, we should avoid any other distraction. 5-1, 5-2, 5-3, 5-4, 5-5, 5-6. 5-1, 5-2, 5-3, 5-4, 5-5, 5-6. So this was 5-pan. I mean 2-pan into 5. Now after 1 minute or so. So you should write it down. Same location, 2-pan.
Yes.
I have done 6 rounds. I should do like that. I should do every 2 to 3 hours. Okay. So 2-pan, heparin, and liver. These 3 together will help you to remove your swelling. And 30 medulla for side effect of COVID. Okay. So 30 medulla you can do once in the morning, and if necessary, once in the evening you can do. So that's all. These 4 will help you definitely, madam. Okay, now last 6-1, 6-2, 6-3, 6-4, 6-5, 6-6. 6-1, 6-2, 6-3, 6-4, 6-5, 6-6. So what is the protocol for you? Write it down. 30 medulla for side effect of medicines. Then CNNS gas, this one over here. Okay. Then you do 1 point liver.
Okay.
And then finally you end with P heparin. Oh, sorry. You also needed 2-pan. 2-pan into 6, 1 point liver, then 2-pan into 6. And finally end up with P heparin.
Okay, last P heparin. Okay.
Yeah, last P heparin.
Okay, sir.
That's all. This one you'll do. Acha, this is one. This is an extensive protocol. Now another. Suppose you are not. Some days you one of this you are not able to do for walk of time or whatever. Then I teach you one very simple technique. Lie on your stomach. Lie on your stomach, and then with your heel just hit the buttocks. No, the heel. You should lie completely, and then like that you should hit. You know.
Okay.
Huh?
Okay.
First to do alternative legs, then do with both legs together.
Okay.
Okay, that will also help you for water retention.
Yes, sir.
So I think that should be enough. Somebody else has raised their hand. Geeta Gupta madam. Yes, Geeta Gupta madam. Very good. Kaise? Yeah. Yes, please. Namaste, namaste, namaste. You please unmute, madam. Yeah, yes.
Namaste, sir. Namaste.
Namaste.
Namaste. I am doing well, sir, with your
Yeah.
guidance and your blessings. Now I want to ask for my husband that he's 69.
Uh,
His BP always stands like 101 by 54, 113 by 55, 113 by 60, 116 by 58, like that. So this is a low BP. I am asking question.
yeah, in a way, it is low BP because see, this is again probably the amount of water he is drinking is not sufficient for his requirement.
Okay, maybe.
So, because you see, otherwise at that age, 69 years, low
Yeah.
BP is not so very common, especially in males. But because they are working a lot or maybe sweating a lot, and
No, not like that. Nothing.
then
No,
then
he's
then he
retired now.
then that means he is working. He is not drinking enough water for his needs.
Okay.
So you please ask him to drink water. But otherwise, this 120, 116, 121, I mean 116 or all is not at all alarming. It is not bad also. It is perfectly okay because you see,
Sometimes 101, 54, lower wala. 50.
that is a bit. That means his water retention. He has to drink some water.
Okay, that's it.
Yeah. Otherwise, he's not unhealthy. No.
He's okay, fine. Yeah.
That's what I also thought. Because 54 is too low, but that is because his blood volume is low.
Blood volume is low. So
And why
for
is
that,
why is blood volume low? Because he is not hydrating himself properly.
okay. For
Okay.
this
Yeah.
simple technique will work.
Yeah. So tell him to take Nariyal Pani.
ठीक है, sir. Okay.
Nariyal Pani will be better because that will contain some essential salts which will help
Yes.
him. Okay.
Okay. ठीक है, sir. Okay, thank you, sir.
Okay,
Thank you.
welcome. Okay, God bless you, madam. Thanks a lot. Okay, so I think with that, yeah, it is now 9:50. So I think we should call it a day. And since nobody else has raised their question, raised their hand, we will do it. We'll have the same a similar class next week by God's grace, and we'll continue. I have got much more to give from this thing. Next week we'll do more distinct treatments, etc. And those of you who are having high BP, please, madam will raise a poll, and if you want to go for a high BP full section, we'll be having about 8 to 10 classes. So you can opt in that poll, because we are having an option either to have another diabetic challenge or a blood pressure challenge class. So depending on your inputs, madam will decide whether to announce a diabetic challenge class or a blood pressure challenge class. I know many people are there for diabetics also. So definitely, thank you, Suryanarayanji. So definitely, we can, depending on the mass requirement, we will consider the proper class. And you will see within 1 month, so many of our diabetic challenge people, almost I will be coming out with the statistics by next week. I'll put it up in the group. I think out of about 67 or so 70 people, out of 70 people, a few are only the therapists, they are doing it for their friends, etc. But otherwise, actual patients, almost I think 55 people have got benefited by our treatments in various ways. And many of them are having blood sugar for nearly 10 years, 15 years, 12 years, 20 years, like that. Even they have got benefited by our treatments. And they have been very sincere. I really thank them from the bottom of my heart, because they have been sincerely doing my treatment. And that is how they got the results. So, and of course, a few people even confessed we did not do it sincerely, and still we got some result. So we'll be doing it now regularly, like that they have confessed. So what I mean to say is, neurotherapy is excellent as an holistic tool for treating without medicines. And it is like any other holistic therapy, like your acupuncture, everything, pepper therapy, acupuncture, everything. So, but anyone, if you are getting good result with another therapy, I don't bother, I don't mind. But if you are not getting results sufficiently well, please try this therapy. And only request is, when you are trying this therapy, don't mix any other therapy at that time. Give her 1 or 2 days gap and then mix. Then do. Suppose you want to do a particular therapy, go ahead. But when you want to try this therapy, then don't mix both together, because both are giants. Both are giants, and we should not make two giants have a clash. So let it be. You do yourself. Whatever you are convinced about, you please do that. Okay. So with that, now I think I will straight away start with the blessings. Okay. Okay. May God bless each and every one of us, each and every one of your families, with health, happiness, harmony, peace, prosperity, and success. Health, happiness, harmony, peace, prosperity, and success. Thank you very much. Thank you to everybody in Joshys Kerala Group. Thank you to everybody in this participants. And thank you, Anusha Madam and Joshi Sir, for helping me to host this. You are giving me a good platform where I can help everybody. Thank you very much. God bless all of us.
Gratitude, sir. Gratitude for this session. This session was, every session is actually very powerful and very informative. But this session was very clear, very informative for many of us. So from all of us, we wish you a big thanks and a gratitude for this session. And remember, everyone, today again, I'm not opening your mics, because I want all of you to go back to the group. There is a poll open for all of you for either to choose BP class or diabetes class, whichever you choose. That will be announced as the paid class for the next coming days. That is after 1 week or 2 weeks, depends upon how many of you are choosing it. Okay. And also remember, please share your feedback for this session. Just because you people are running away after giving your vote of thanks, that is not good. We want you to go back to the group and give each of one of your feedbacks there for this session. And for all sessions of Ramachandran sir, any queries, everything is welcome from all of us for you. So please go back to the session, and we want almost 61 to 70 feedbacks in the group, no less. Okay. So I want all of you who have participated to please go back and please inform about the feedbacks, comments, polls, everything you just go through. So thank you so much from all of us. Gratitude to you, sir, for this wonderful session and very informative session. And happy weekend to you. And tomorrow again, we have 7:30 p.m. Acupaper Therapy Heart Meridian class. Please don't forget to join. And Sunday 11 a.m. 5 koshas is the topic. Okay. So please attend all the sessions on time without failing it. Thank you for today's session, sir, from all of us. And I request again, please go back to the group and write your feedbacks. Thank you. Ending the session, sir. Thank you. Good day to you. Bye,
Thank
sir.
you.
Happy
Bye.
weekend. Ending the session, everyone. Thank you.
Thank you.